Hi, it's Phil again.
Hi, it's Bindy.
So today we're going to talk a bit more about our Swift machine. So it's Swift microwave therapy for plantar warts. So plantar warts are something we see all the time. To be honest, I never used to like seeing plantar warts because there's quite a few different options to treat them, but they all have some pretty unpleasant downsides. So we're going to talk a bit more about the machine today that we have, and we've had it for a few months now, and talk about the benefits of it and why we're loving using it so much. So the first thing we probably should talk about is how the technology works. So Bindy, do you want to talk a little bit about how this machine works and how it's different from other cautery techniques?
Yeah, the great thing about this one is it's just a small machine with a little head which just zaps, which we target on the actual wart itself, so it's very specific to the area. It's adjustable, so depending on what the patient can tolerate, the size of the verruca, we can change the therapy according to that. And there's lots of benefits to this therapy compared to things like chemical therapy, which we've used in the past.
Yeah, with plantar warts, they're actually caused by a virus that gets into the skin. So when you see a wart, it's sort of bubbling up with that extra growth of tissue, and really the idea of treatment is to stimulate the immune response so that your body can get rid of the virus, and once that happens, the wart will go. Other techniques, I might just go over some of the things that we've used in the past and that your regular GP will use. The first thing you usually try is you go to the chemist and buy a little bottle and paint some like a low strength acid on the wart, which really is quite ineffective, particularly for deep plantar warts. It's hard to penetrate deep enough.
Stubborn ones,
yeah, it's okay for warts maybe on your hands or other areas of skin, but under the foot they can get really quite deep. Other techniques include stronger acids, so we use strong salicylic acid in a paraffin. The downside of that is it can cause like a chemical burn, as you were saying before, Bindy. That can be painful for quite a period of time.
Yeah. And then you have a dressing, you leave the dressing on.
Yeah.
You usually leave it on for a few days if possible. Then you come in weekly so we can debride and review and see how you're getting on.
Yeah, and often you'll end up with a very sore part of your foot, which is hard to put pressure on, and yeah. Another technique that does get used is actually physically cutting out the wart. So whether it's curetted or using a scalpel, but that you need needles for that, and you have a wound on your foot, you got to look after while it heals. So a lot of people aren't interested in that. So the benefits of the Swift, it's actually giving, we'll give a really close look up of the head, but it's not going to cause you any pain or any damage, and actually the head itself doesn't heat up at all. What it does is it actually emits, so when we actually put it on the area, which Bindy will demonstrate in a second on my foot, it actually emits microwave energy. So it's the same thing that you use in your kitchen to microwave your food, but it's applying that microwave energy to a depth of about 5 millimeters to the affected area, and it's heating it to about 45 to 48 degrees. So it's not actually causing a chemical burn. We're not actually burning the skin, we're just heating the tissue to the temperature that's necessary to cause that immune response. So the tissues release heat shock proteins, and the body gets very excited and says, wow, there's something happening here, and your body itself will actually get rid of the plantar wart, which is cool, and there's no other treatment like it available. We're actually really proud here at Pioneer Podiatry to offer this treatment. We were referring patients down to Brisbane, to the one place that has one in the state. So I think we're the second clinic of any sort in Queensland to get this, because we really love to bring high value, world-leading treatments to our region. So the benefits, Bindy, what other benefits would you say with regards to the treatment other than the ones we've mentioned?
So it's on the spot treatment. It's usually lasts a few minutes depending on what the prescription is that we give. No dressings required because there is no wound. There's no limitations to what you can do. You basically walk in and walk out in a few minutes, job done, carry on with the rest of your life.
Patients often ask if it's painful. So what do you respond? How do you reply to that question?
Everyone's got different pain levels, but it's an instant slight pain. Some people find it more painful than others. It might just be painful in the last, depending on what the prescription is, we do a certain setting for a few seconds. So most people so far have found it might just be the final 1 second that gets painful, but it's so short, it's worth it compared to, days of pain that you might get with other treatments. Yeah,
that's really is the benefit. It's short amount of pain for 1 second, and then it disappears. Really good for children, because children get very nervous. Even using, we didn't talk about it before, but cryotherapy, so using liquid nitrogen to freeze it, that really hurts. It's really
it can
painful.
Cause blistering, lots of side effects.
Yeah, so with kids, we can actually use this treatment technique. We can dial it right down. So really, the first few applications, they barely feel at all, and we can dial it up one sort of a tenth of a joule at a time, so that they are just sort of feeling that feeling of warmth. And it's all about getting enough joules into the tissue. So joules is a measure of energy into the tissue. So yeah, school holidays are coming up. So if you're interested, that'd be a great time to get in touch with us and jump in and get kids' warts looked at. One thing also that's important to realise is that podiatrists generally, we are only allowed to treat the foot and leg. But we have, because this machine is so unique and because it's such a low risk use, we actually have insurance and coverage to treat warts on the hands and arms as well. So that's something to keep in mind. Who can't use this machine, Bindy?
So it's suitable for most people. The main groups of patients that it wouldn't be suitable for, but again, it depends. Always have a consultation with us first. Because the suitability can vary a little bit, but usually people with pacemakers aren't suitable. Ideally, if you're immunocompromised, obviously because it's a virus, results might not be so great. And if you're a high-risk diabetic patient. But again, it's always worth a consultation, because until we've got your full medical history, we know what the risks and benefits are. We can discuss them with you and then take it from there. Yeah.
Okay, well, how about we do the demonstration? I think that people will be interested in that.
So pop that on. Okay, so we have the head, and Phil's got a verruca just here. Lovely pretty wart. So what we do is, on the machine we'll do a setting depending on what's suitable for the person. We will just change some of the wattage and change how much time it's done for. So for example, if we have a higher wattage, we might do it for less seconds, or we'll do a lower wattage at more seconds. We have a protocol that we tend to work on, so there is a total kilojoules, 100 joules that we try and work towards. So it can be spread out across many seconds, or just a couple really. Alright, so once we've got the setting, place the head on the wart area. So with Phil's wart, it's quite large compared to the head of this, so that will require, I would say, three sets of treatment. So it's usually about 5 times on the same area. So you target that just there, lightly press the button, and then it does its zapping. And then we'll do that a few times on the rest of the area, only covering verruca tissue, not healthy tissue, and then we're good to go. It's pretty much done.
Easy. I didn't feel a thing. So another question patients ask is, how many times do they need the treatment? We follow well-established protocols, which is we do it once a month until the wart is gone. Most people, we'd see a result by the first month. We see some the wart disappearing with that immune response. But generally, most people, we do 3 sessions because we really want to make sure we get rid of it and it doesn't come back.
And also, just so you know, we have some information on the website, but in clinic we've got some leaflets available which has got all the full patient information there, more details about the Swift machine and how it works. So yes, get in touch with us. It's always worth a visit.
Yeah, absolutely. And yeah, particularly if you've had a plantar wart for a long time, there are a lot of people out there that have had them and they've tried everything. We have found we're loving to use this because it's just getting rid of this problem for good for people. So we'd love to help you if that's you. Okay, that's enough for today. Thank you for watching.
See ya.